Good morning, everyone. We are just going to wait for just another minute to let folks settle in and we'll begin. I see folks are joining the webinar, so we're just going to wait just another few minutes and get settled. We'll dive right in. Okay, I think we're going to go ahead and get started. Hello and welcome, everyone. Delighted to be joined by so many of you from across the country. My name is Soledad Adriansen-McGrath, and I am the Executive Director of the Northwestern Neighborhood and Network Initiative, or N3, and Research Professor at the Institute for Policy Research at Northwestern University. I am so thrilled to welcome you to the first installment in a 4-part webinar series on community violence intervention. This series is a partnership between Giffords and N3 and spearheaded by Paul Carrillo, Community Violence Initiative Director at Giffords Law Center, where he and his team advocate for federal, state, local, and philanthropic funding for life-saving interventions, including, among others, street outreach, gang intervention, violence interruption, hospital-based violence intervention, case management, mentoring, and life coaching. We at N3 work directly with community organizations, civic partners, and policymakers on research projects that seek to bolster their efforts to address gun violence and build communities that are safer, healthier, and more equitable. Using a community-engaged model, we work alongside our partners throughout the research process to help them maximize the impact of their work. And we seek to marry the expertise and lived experiences of our community partners with network science and other analytical tools to answer timely research questions about how to build safer and healthier communities. In all our work, we aim to promote a shift toward more equitable research partnerships. We launched this series at a time when we as a nation continue to grapple with a recent national surge in gun violence, the devastation of multiple public health pandemics, and years upon years of systemic community disinvestment. It is also at a time when, through the tireless efforts of Black and Brown leaders across the country, there is increased recognition and acknowledgement of the critical role community violence intervention strategies play as part of our broader public safety infrastructure. This renewed focus has led to welcome innovation and public dollars, as well as increased expectations. So today you will hear from CVI leaders from Chicago, Washington, DC, and Oakland, who will share lessons from their work to disrupt cycles of violence and save lives. Paul will be guiding us through what I know will be a robust, spirited, and informative conversation, and help set the foundation for our future sessions, where we will begin digging deeper into various aspects of the work involved in CVI. Today's distinguished panel includes Guillermo Cespedes, Chief of Violence Prevention for the City of Oakland, Susan Cruz, Licensed Forensic Social Worker with the Public Defender Service for the District of Columbia, and Melvin Hayward, Head of Programs at Chicago CRED. There will be an opportunity for Q&A, so please feel free to submit your questions via the Q&A feature. And please note that this webinar is being recorded, and a link to the recording will be made following the session. So without further ado, I'll hand it over to Paul.
Thank you, Soledad. Thank you very much for your partnership and for the kind words. Welcome, everybody. This is an honor and a privilege to be here with our partners from these various organizations. I have worked on the ground in Los Angeles with our three panelists here. We'd like to think that we had some level of impact and involvement in LA's success a few years ago, obviously before the pandemic when we were at 50-year lows in homicides. And so I just want to point out that I have a tremendous amount of respect for these three individuals. And obviously now they're in different organizations and doing work in different parts of across the nation, but it's a tremendous honor. So I'd like to start off and just jump right in, if it's okay, and ask each of the panelists if they wouldn't mind sharing a little bit about their background and their experience as it pertains to community violence intervention. And we'll start with Susan Cruz.
Good morning, everyone. Thank you, Paul. Thank you, Soledad. My name is Susan Cruz. As Paul mentioned, I'm a licensed forensic social worker with the Public Defender Service. I work in Washington, D.C., and prior to that, I was living and working in Los Angeles, where some of my experience included working in hospital-based violence intervention programs, working within the juvenile justice system of Los Angeles, which is the largest in the nation. There are 18 juvenile detention camps that house thousands of children in conflict with the law. But my personal experience comes from being from El Salvador and having grown up in a country that was torn by civil war. Then being displaced and coming to the United States and growing up in Hollywood and dealing with community violence since I was in elementary school. So it's very personal to me. My background is not only in social work, it's also in public health. I actually started out in public health because I wanted to look at the issue of youth violence on a macro level. When you think of medicine, you think of working one by one, patient, doctor or practitioner relationship. And many years ago, as I was trying to understand, my own experiences with violence in my country, in this country, I was trying, to think of a way how those experiences, could be put to good use and for them to mean something, not just, for myself and my community, but for everyone that is generally afflicted. And we know just by looking at statistics, there are disproportionate contacts with certain populations that are most affected by this. Thank you.
Thank you, Susan. Guillermo.
Good morning, Paul. Good morning, everyone. Susan, Soledad, Melvin. It's an honor to be here. My current title is Chief of Violence Prevention for the City of Oakland. I lead a department of 38 staff members, roughly $29 million budget. I was the deputy mayor of the city and director of the Office of Gun Reduction of Los Angeles, and led the office and was led by the office when we achieved a 7-year period of close to 50% reduction in 9 categories of Part 1 crime. Most of that was accomplished through a place-based strategy, relying very heavily on CVI, specifically relying on CVI through multiple points of entry, including the crime scene immediately following a shooting with serious injuries and homicides. Prior to between LA and Oakland, I spent almost 5 years living in Honduras in Central America and working, directing programs in Honduras, El Salvador, Guatemala, and 4 countries in the Eastern Caribbean and North Africa. Most of that has been really the extension of the work that was developed in LA during a tremendous period of innovation with many, many, many people, including the people on this panel. So it's an honor to be here and to share some of those experiences, specifically around CVI, but a little bit about the broader picture as we move forward. So I look forward to the discussion.
Thank you, Guillermo. Melvin?
Good morning for folks on the West Coast. I'm on the West Coast, and good afternoon for folks in the Midwest and the East Coast. Melvin Hayward, head of programs of Chicago CRED. Chicago CRED is a multifaceted violence prevention organization with a primary focus on reducing gun violence in a transformative way. And I've had the honor to serve as head of programs at Chicago CRED for the last 2.5 years. The vast majority of my career was in Los Angeles, where I was the co-founder and executive director of an organization called Helper Foundation, where I led the work on the ground with the team, but also did a lot of national work and traveled the country to upwards of about 30 cities doing technical assistance and training, intervention/outreach workers, and helping to build program development with city, county, and nonprofit organizations. I've had the blessing to do this work since the late 90s. And this work is extremely special to me. Before I did this work, my father did this same work for 30 years on the West Side in Los Angeles. And now my son, Melvin III, is doing this work. So I'm happy to say that this is in our blood, it's in our genes. And I'll say, also I have personal experience, like Susan talked about. I was involved in the lifestyle of being a gang involved for many years from the age of 10 until my late 20s. And so I understand what our youth and young people are dealing with from a personal perspective. And I always tell the young people that's caught up in this cycle of violence is that there is a way out, there's hope. And if a person like me can change, I always tell them anybody can change. And so this work has saved countless lives in Los Angeles and Chicago, and I'm just happy to be on the panel here with my colleagues today. Thank you.
Thank you very much, Melvin. So, what we're here to talk about today is community violence intervention. CVI is the new kind of catchphrase floating around our industry. And to be honest, in my opinion, I feel like most Americans don't know what CVI is. And from what I see and hear is there's a percentage of individuals who think they know what CVI is and they don't. They got it wrong. And so, this first installment of a 4-part web series, we really felt the need to just kind of start with like the basics, the fundamentals. What is CVI and what it is not? Why is it important, etc. So today, our panelists will help us kind of explore the definition of CVI to some extent, what it entails, some case studies, some examples, etc. To me, there's different approaches that fall under the CVI umbrella, and the key word in CVI is intervention, and the work can be called different things based on what city you're in across the nation. It could be called violence interruption, gang intervention, street outreach. But I think the key is, again, that term intervention. And so we'll explore that throughout this conversation. And so I wanted to start by asking our panelists each to give, in your words, can you describe what intervention means to you? And we'll start with Guillermo.
Well, I think there's a lot of components to intervention that it means to me. I think most of it has to do with individuals from specific communities with credibility in those communities, being able to intervene in patterns of violence, oftentimes violence associated with group or turf identity, and intervene, not arresting people, using dialogue, using relationships, using mediation, and with the ultimate goal of the police arrest people, intervention, arrest people related to a homicide and tries to solve that homicide, intervention looks to prevent the next one. So 2 completely different lanes of operation. If we think of a highway, they get off at the same exit, violence reduction, but they do it very differently. One is done through relationships. The other one is done through enforcement. And then the last thing I want to say that it means to me is that from the LA experience, I see community violence intervention as having three specific outcomes that can be measured. One, reduction of retaliation. Two, reduction of trauma. And three, the improvement between city government and marginalized communities. And we'll get into that a little bit later. Most of the time, people focus just on retaliation. I think it's broader than that. I think the community piece is very, very important. So anyway, let me leave it there and we can come back to this.
Thank you for that. And we'll go to Melvin next, but I just want to highlight one particular thing that stood out to me that you shared was differentiating between police work and intervention work that is largely done by homegrown peacemakers. Go ahead, Melvin.
Yeah, I definitely agree with Guillermo and his description of the work, and I'll add to it. I think oftentimes we don't talk about the ability to mediate conflict in communities affected by violence. And so the frontline workers, intervention workers, outreach workers who have something that we call a license to operate, which is essentially permission from the communities that oftentimes those workers are indigenous to or have long-term relationships in, have the ability to meet with the key individuals who are either controlling or leading those groups and heavily involved in the violence. And so intervention outreach workers are continually interfacing with those folks on the ground and having conversations about peace and alternatives to violence and coming up with agreements that we call non-aggression agreements, which is folks having a short-term period of time of peace and folks stand on each other's sides and not intermingling with one another. And then something that's long-term and lasting is peace agreements, where we've seen all across this country that folks have been able to incorporate peace agreements in communities affected by violence, and violence is reduced at a high level. But I think another element of this work that is extremely important is the services that are provided in programs across this country. And I'll speak for Chicago Cred. You know, we operate from a 5-pillar project. So we provide outreach, clinical services, life coaching and mentoring, education and employment and training. And my philosophy is this: we can talk to a person until we turn blue about stopping the violence, but if we don't change the mindset of an individual that's been conditioned to live a certain way, we'll never change the behavior that an individual is connected in. And so being intentional about dealing with trauma stress management, cognitive behavioral interventions, and having the ability to help a person walk through setting goals that are realistic, worthwhile, and attainable for them changing their lives. And what happens is that individual feels better as a human being, that they're becoming more productive. They're starting to self-differentiate from the group and who they were. And then others recognize those individuals in their change, and people want to jump aboard. And so I think much deeper than what we ever talk about is the transformational process that an individual has to go to remove themselves from that lifestyle. And so community violence intervention is very deep into that process. And I just thought it was important to prop that part of it up.
Absolutely. That was perfect, Melvin. I do notice that there's some folks active in the chat. We want to encourage that. Please feel free to, put your name and organization and let us know where you're coming from if you'd like. And, one critical thing that you mentioned, Melvin, that folks should know is, when I started doing the work, gosh, about 20 years ago with you, Guillermo, and Susan in LA, it was very heavy on the interruption part of the work. And it was, and many folks, that's all they did and thought that would take us to, to have lasting peace in LA, but that's not the case. And to your point, as we evolved, and I credit the Grid Office and Guillermo for requiring contracted intervention agencies to do more than just the interruption, the case management, all the social services that are needed. And so, to me, when I interact with folks across the nation in different agencies, if I see that they're heavy interruption and not so much the life-changing services that are needed, to me, I can tell they're off the bat, they're in their infant stage of implementing the strategy. There has not been an evolution, which is key. Go ahead, Susan.
So many moons ago, I was working the graveyard shift at Children's Hospital, and I had a paper that I had to write. And the topic that I had chosen was on compassion fatigue. Sometimes we, call it burnout. And because Children's is affiliated with the USC School of Medicine, they have a library inside the hospital, of course, in the basement, where it's difficult to find. But I was looking for articles about this, and I came across a study that really had nothing to do with burnout, but I found it quite interesting. It was a study that was done by a social worker where she looked at the lives of 37 men that had been on death row in Texas and had already been executed. She wanted to find any differences, between this cohort of men that have already been put to death, and she went as far back as looking at, their young adulthood, childhood, etc. She went beyond the specific crime and circumstances by which they were put to death. And across the board, they had all committed heinous crimes, and they were all, in different places in their level of understanding and accepting what had happened at the time of their death. But she dug a little further, and by reviewing records and talking to people that knew these men, she started to find some differences. I think the first and foremost was that the men were divided into two groups in terms of remorse, in terms of humanity, and how they reflected upon what had happened, what they had done to others and to themselves, before they were executed. And these men had remorse. They apologized, they asked forgiveness, and they tried, to come to terms, with what they had done and what had happened. The other group of men, on the other hand, felt no remorse, took no responsibility. In fact, some of them even said that they would do it again if given the chance. And then she dug a little further, and she found, what was it about these men that made them different in that regard? Why was one group still able, to express humanity while the other didn't? Well, it had everything to do with what kinds of interventions happened in their lives. And the group that expressed remorse, that asked for forgiveness, that understood, that, this was them having, to face justice as we understand it in this country. There were people in their lives. Both groups of men had had horrible circumstances, child abuse, neglect, abandonment, all sorts of horrible things. In that regard, they were all the same. The difference was that in the first group, there were people and there were systems in place, a teacher, a coach, a social worker, a pastor, somebody that gave a damn about them and about what they were going through. Somebody showed them humanity, and that intervention of showing someone that they are human and that you are accepted and understood, and that you deserve, to live, that you deserve, to be loved and cared for and protected. That's what made all the difference. The other men, no intervention. And if that, says anything about our responsibility as a society to intervene early on in every opportunity, I don't know what else, to say, because for me, that's been sort of the rule of thumb, that you intervene at every opportunity you have.
Very well said, Susan. Thank you very much for that. I want to get a little bit into, case studies or examples of interventions that have worked in your experiences. But before we do that, we'll start with some misconceptions about community violence intervention. Perhaps it's a situation where each of you found yourself having to explain to somebody what intervention really is because they had the wrong idea. or a situation where you're in the middle of watching an intervention take place and it just did not go right. So I'll call on Malvin first, if you don't mind starting us off by sharing misconceptions about community violence intervention that are out there.
Sure. I alluded earlier to, having to explain and go a little bit deeper on our work. And I think the misconception is most of the time focused on just doing the outreach intervention work in the field. And I think for me, it's always good to explain how deep we go in our work and the, innovative strategies and techniques that are happening on the ground. And so, I've had to have several conversations throughout the years about our work, what it means and how important it is. And I think the other thing is the perception that, once a gang member, always a gang member. And, I talk about this thing of folks that do this work on the ground, oftentimes get into this occupation because they want to atone and reconcile for the wrong that they've done in the community. But throughout the years, if folks start to grow and they start to change internally as professionals, people really are committed to this career and really want to see change happen. And so, I also talk about individuals who this misnomer that participants and folks that are engaged in the community don't want or are not open to therapy. And I can tell you that in my experiences, that's not the case. We have serviced over 600 young men and women in the last couple of years at Chicago CRED. And one of the strongest elements of our program is the therapy and the trauma stress management and the cognitive behavioral intervention. And when you hear high-risk young men and women start to regurgitate the strategies and the techniques and how it's helped them in their personal lives, for me, it's just a beautiful feeling to hear that misnomer is being broke up every single day. And in closing, I think the one that I've been faced with a lot is, can non-traditional leaders lead the charge in this field? And do they have enough skill set and the wherewithal to lead organizations? And I always say absolutely, but it's similar to what Susan said. It's important that we provide the necessary support. We have the infrastructure development in place for small nonprofits to become successful. And so, I think that we've come a long way from the days that I've started doing this work, but I can tell you we've professionalized this field in a phenomenal way. And I just see things getting better and brighter in our future.
Thank you, Melvin. Guillermo, you want to go next?
Yeah, I think for me, I break it down into two things. One, we have to change specific behavior. Less identity, but more change the behavior. And we have to change the conditions that sustain that behavior. So to me, CVI means you do, like Melvin said, work with individuals to change the mindset. And you also have to make sure that that community, that family, that system in which that individual lives can sustain that behavior change. Melvin is not the same Melvin that used to be many years ago. So once he transformed into, any of us transform into a new space of being, we need our environment to support that. How does it get done? I think both working with individuals, working with families, and working with communities. The other part is that I think that Melvin mentioned that he called it traditional leaders. Some people call them credible messengers. It's a lot of different labels for it. But what we have learned over the years is that the people closest to the problem with some training are the people most likely to be effective in solving that problem. So CVI, in my opinion, requires that in terms of specific cases, very many, some that have to do with violence interruption, have some that have to do with people transforming themselves, some that have to do with people becoming, there are lots of, examples right on this panel. People that have transformed themselves from being a part of the problem to being, the implementers of a solution. So I don't know if we need a stronger case than that, but that's pretty evident that all of the work that people on this panel are doing are testimony to that. So again, I'll come back when we have question and answers, but behavior change and the community, changing the community that accepts that behavior. One of the things that we're noticing recently is that very oftentimes young men and women that change their behavior go through a period of really being at odds with their neighborhood because the neighborhood expects them to behave in a different way. And that's a process where we have to monitor, we have to work with the neighborhood. So as well as the individual, that's what community violence intervention to me means. It's individual and community work. So yeah, I'll pass it on back to you, Paul.
Very well said. Susan?
I think the biggest myth is that we are somehow, dismissive or even enabling people that commit violence, and that is not true at all. Oftentimes, people ask me, how can you work, with criminals? How can you defend them? How can you? Well, first and foremost, we have a justice system. It's not perfect by any stretch of the imagination, but believe it or not, people are surprised when I tell them that the large majority, if not all, of my clients, will say, I accept responsibility. I just want a fair shake. I accept, what I have to do. And so there's a misconception also, in which perhaps, not in a public interest law firm, but in the community, there's an expectation that somehow community intervention workers have to cooperate with the police, or that they are somehow an extension, of law enforcement. And that is not true, even though they do get bullied by law enforcement a lot. But that's not, what they are. And so I think, the myth of really not understanding, what this work is huge. But more importantly, to know and to push forward, the message that we want the same thing. We want our communities at peace. We want people to live full and healthy lives. That does not mean, that we're going, to tilt one way in favor of law enforcement and their function or help them do their job, because that's not, what we do. Or, help people that are committing violence and say, what, that's fine. You go do you, and I'm not going to stop you. That isn't true either. We hold people accountable. We hold ourselves accountable for the work that we do as well. And so I think, at least to me, that is the biggest myth about CVI.
No, that's on point and perfect, Susan. Thank you for sharing that. I want to ask each of you now, if you can. Every time I see each of you, I feel like we share stories of a new intervention that we experienced or that our staff was successful in. But if there's any particular intervention examples that come to mind that you're comfortable sharing, with the audience in regards to how intervention can work. And whoever's ready first can go first.
Well, the one really innovative intervention that I'm seeing on the ground in Oakland right now is young men and women who have identified families that are related by blood, but they're on different sides of the turf conflict. So the intervention is actually grouping these families to become peacemakers in a neighborhood because they have a lot of power. They're related by blood, but they're on opposite sides of the conflict. And so these young men and women, most of them are pretty young, are identifying families to work with and carrying out activities related to hitting the pause button by providing services to families, by developing activities with families, but also by developing the organic tendency of families to want to live at peace with their families. So this is a very recent approach that we don't have specific data on yet, but I've been really moved by it because it is really combining family interventions with community-based violence interruption, with family coaching, individual coaching. It is really a comprehensive approach of all the things that include community violence intervention. And the point of entry is the streets. So just blown away by just the innovation that that's evolving around this. And I'm looking forward to having some data to be able to quantify why and how this is effective.
Yeah, I'll add, we are trying something new and innovative in the North Lawndale community in Chicago, where you have Chicago Cred, Ready Chicago, and Communities Partnering for Peace through UCAN, coming together, 3 large organizations that are intentionally collaborating to serve upwards of 1,200 of the highest risk individuals in the North Lawndale community. And as my colleagues know, it's extremely hard to bring separate organizations together that operate a little bit differently, may have a different philosophy on the strategy and how we execute the mission. But we have been extremely intentional about starting year 1 with serving 700 acutely at-risk individuals in the North Lawndale community. We have created a referral process where we are working together to make sure that if one organization may not have the desired service or program that an individual needs, you can refer that individual out to a partner organization. And I know Soledad knows too well about this project, as N3 is supporting us in this process. But I think what's extremely innovative about this is my colleague, Jalen Arthur, has created something called the dashboard. And we're talking about higher level of accountability, because when you build collaboratives, I think what people shy away from is working together brings accountability. And so what we've incorporated is a dashboard that assesses the number of participants that are served in that community by each of the organizations, that's open to every organization. We're assessing the violent incidents that are happening in the community and where those incidents are happening. We're also assessing the participants who have been impacted by violence and/or incarceration. And we're assessing the number of non-aggression agreements and peace agreements that's happening in this partnership. And it's nothing like I've ever seen in all of my years of this work. And so we're hoping and praying, and we're optimistic that this is going to change the course a little bit on how we do work in the city of Chicago. And I'm looking forward to this process as we continue to proceed, but we will definitely provide updates as this project continues to flourish.
So I think one of the most innovative techniques or that I recently learned about, and by recently I mean like a couple of years already, is called defense initiated victim outreach. And it's along the lines of, the idea of restorative justice. Oftentimes when a crime is committed against another person, the prosecutors and law enforcement will work together, and approach them as witnesses or as victims, or as we call them in DC, complaining witnesses. And their approach is very specific. It's very specific to the process that will take place in court, if they will testify, et cetera. But there really is not that much in the way of providing services to them. There are very few courts that have victim advocates. And sometimes, on the defense side of things, we find ourselves talking to the family members of the complaining witnesses, of the people that our clients have hurt. And so when we talk about making things right, making things whole, not just for a person, but also for an entire community, we cannot forget or just leave in the back seat, or the back burner, sorry, the idea of restoring justice. And I think, when we intervene, we have to have a very thorough and well thought out approach in which we're not only trying to prevent the next injury, the next homicide, the next loss from happening, but rather, how do we make whole someone that's been hurt? Because oftentimes I have found, particularly with individuals who carry guns, they were victimized and no justice was ever served for them. And so they feel that they cannot be protected, especially if they belong, to a group that's been disenfranchised, for ages. So they feel the need to carry something to protect themselves. And unfortunately, the statistics are against them in the sense, that they will likely end up getting hurt anyway, sometimes even with their own gun. And so I think really understanding how do we make someone whole so they don't feel that they have to take it upon themselves to protect themselves and live in a sum-zero world where it's either you or them.
Thank you. I want to offer this up. I mean, I've heard this from different organizations, different individuals. I don't know if there's like an anointed, clear definition of CVI, but to me, in my opinion, it's essentially starts with engaging those at highest risk of being shot or doing the shooting. And then number two, providing a life-changing intervention that will lead to a reduction in violence in the community, starting with that individual. In my opinion, that's kind of what I hear us all saying, or hear you all saying, and the easiest way to kind of put a description on it, if you will. But we can continue to debate that for the end of time. But the key is the highest risk, and a lot of organizations, especially now because the federal government is showing significant support for community violence intervention. So that means dollars are coming, and a lot of organizations who have never done CVI work before are all of a sudden now doing CVI work. It's not necessarily a bad thing, but if they're not using the proper approaches and engaging those at highest risk, then we run the risk of some organizations receiving funds that are not reaching the ground and reaching the individuals and the efforts that we're all talking about, that can fund and adequately pay people to do the job that very few can. And it starts with relationships and relationship-based interventions. So we have a couple of minutes before we get into Q&A, and I want to encourage the audience again, please use the Q&A option to submit a question. Here's the last question before we move on to the Q&A. How is the success of intervention measured? Right, so it can be an example of like on the ground, or it can be a high level lens. But I'll start with Malvin, and you run programs at Chicago Cred. How do you measure success?
So a few ways. I think first, looking at it from the individual level success, number one, we're assessing the participants' relationship to violence. And so we're assessing from multiple perspectives. Number one, our data, we use Salesforce, how that individual is participating in our program, how they're working through our modalities, and how they're engaged with our therapists, our life coaches, our education, and if they are transitioning forward in the program. We have an 18-month program where we're assessing seat time and how folks are transitioning through the program. But also our outreach workers are also working with those individuals in the community to see if their days are matching their nights. And the outreach workers are uploading data in the system to support what's happening on that end. And so, it's a tedious process, but I think with all of our partners, what we call our base team, working together, wrapping their arms around that participant, they are all infusing information in the system to assess the transformation of a participant. But also externally, I think what's really important is the community level change, because we can put 1,000 hours into an individual, But if we send them back into an environment that doesn't support the change, we're working against ourselves. And so, like Guillermo said, we're also assessing the stability and readiness of the families that's connected to the young people, making sure that we're supporting them financially, making sure that we're referring them to organizations that can deal with whether that's home issues, that's paying supporting bills, making sure that the family is moving away from a violent situation. So we're assessing what's happening in the home, but also overall, we're assessing the violence in the communities. And are we reducing violence in the communities we're served? So obviously we're looking at CVI data. We are assessing the data that we're using with the number of individuals that's involved in groups and or gangs in the areas that we serve, and how many of those individuals that we're referring into our program or our partners at CP4P already. Because what we know in Chicago is that there's a vast majority of individuals that are not being served. And there are communities and groups that are underserved. And we know that if you have young men and women interfacing in programs like ours and programs across this country, you reduce the potential for that person to be engaged in violence. And so right now, N3 is doing a study on our work. We've been working with them for a while. And so we're seeing some promising things coming out of the study. It's a little premature at this point to really delve into it, but I'm sure Soledad would have some information on that. But I think we're assessing the work from a multi-pronged perspective to ensure that we're covering the individual, the family, and the community.
Thank you. Guillermo, before Susan jumps in, you were deputy mayor and ran the grid office, and obviously now you're the chief in Oakland. From your office, right, you oversee, significant amounts of money and efforts to reduce violence. Like, how do you measure success of intervention?
Well, we're expanding a little bit on what Melvin said based on, this work keeps growing. So Melvin mentioned 3 domains: individual, family, and community. We're really, our evaluation now is going to focus on individual, peer, family, community, and school. And we really want to be able to measure the impact. Regrettably, most of the work in our field, most of the evaluation has focused on individuals. And we think that should continue, but we want to expand and look at other things because particularly from the experience in LA where, we went through a period that, say, between 2009 and 2012, we responded to over 2,800 crime scenes. We saw the impact of that on communities, individuals, schools. And so I really am pushing for this new evaluation to look at a broader range of how community violence intervention impacts things at 5 domains: the individual, the peer group, the family, the community, and specifically the school. And we want to keep working with researchers to expand the way research gets done, that is not just at the individual level. So to me, that's what, success is. And at the community level, I include, it is not accidental. That is the communities with the highest rates of COVID infection, and there are the communities that historically have the highest rates of violence. Those of us who have worked in government, have abandoned these communities. So we do have to measure, are we re-engaging? Are we reinvesting? Are we getting credibility? Do we have the credibility to work in these communities as government? And I say we need to really improve that. So that's the other measurement that we need to look at is, how effective. The work that you all did in LA, one of the things that it changed is that it changed who came into City Hall. The mayor's office ended up becoming a part of the community for a period of time. It's now back, it's gone back a little bit because it's something that needs reinforcement. But anyway, that's the things that I would like to measure. I do think CVI has been understudied, underreported, and we don't really, one of the gaps is that we haven't dedicated research specifically to look at all the different places that it impacts.
Thank you, Guillermo. Susan, in your experience, in your work, how do you measure success?
So I'm going to answer that and also hope to answer a question that was posted in the chat about how targeted areas just displace the problem, which in a way is true, but then again, a lot of other things that are used to address violence also displace the problem. I mean, when you look at incarceration, when you look at deportation, all it really does is just move the problem someplace else. Because unless you address the root causes of the problem, it's just going to go someplace else and start from there. So in my experience, what works generally has a lot to do with the individuals who are causing the violence and are also the recipients of acts of violence. And I understand, that a lot of the measurements are very focused on individuals because that's, how you measure behavior change. Yes, there is, collective group behavior, but, that's not really what we're talking about here, at least, from, what I'm representing. So the way, that I measure success is when someone says, I'm ready, to do something about this. I'm ready to talk to somebody. I'm ready to start a program. The problem with that is that generally underserved communities have a much higher challenge to face when trying to find providers, whether they're mental health providers, substance abuse treatment programs, family counseling. They have a much higher challenge that they have to overcome to find practitioners who are, culturally equipped to address, the issues that our clients, have to face. There may be language barriers. There may be financial barriers. And the pandemic has definitely shown the ugly side of this problem because people really were pushed to the brink of saying, you know what, I really need to talk to somebody. I really need help, but there's no one there. And clinicians are leaving the profession in groves for the same reason, because there are no supports in place for them. I mentioned earlier, writing a paper about burnout. And that's exactly what, how you measure success is dependent on all the other factors that are there to make sure that success happens. For example, a continuum of care. If you can only measure success if you look at a continuum of care. If a child is being bullied at school, what was the school's response? What was, the family's response? Not just of the child that's being bullied, but also the family of the child that's doing the bullying. And so you measure success from there. And then it's the children refer to talk to somebody. What is the success of that intervention, and so forth. When you look at someone who commits a crime, and you look at the continuum of care, from the moment that handcuffs are put on somebody, you have to start intervening. Even if they don't go to prison. But oftentimes, when they do go to prison, we tend, to forget. We conveniently forget that over 90% of people that are sent to prison are going to come back home. And we can no longer afford to ignore that. When they come back home to nothing, to more challenges, to not being able to find employment, to being subjected to discrimination and, a host of other things that prevent them from being meaningful members of society. That's something. So for me, success, is about how that person feels that they are connected and engaged with their community and how they see themselves in that community. And everything around them, how well it works to make sure, that happens.
Thank you all. Right now is the time. I think we're at time. I'm trying to keep up with all the questions, and we'll try to get to as many as we can, but we're gonna move into the Q&A portion of this webinar. And what I'll do is I'll grab a question and I'll direct it to one of you, and then we'll just keep going and try to get as many as we can. There's one here for you, Guillermo. I think you're the best person to answer this. Let me see if I can find it. Can you discuss the importance of specific metrics to measure the effectiveness of CVI programs to justify continued and expanded federal and state funding?
Can we justify specific metrics? Well, I think the panel has been talking about specific metrics. I think the issue is we really do need to invest without taking away from the direct practice. We need to invest in two things. One, research that is relevant to this practice, which means developing a partnership between those that are intervening on the ground and research entities. The innovation that I spoke about, the young men and women that are identifying families, they're also being in the initial training of looking at data and all of that. So I think it isn't just about specific metrics, it's about who is doing the research. Just the same way that when we talk about CVI, we cannot forget who is doing the intervention. If Paul has the ability to intervene in a particular community, and I remember when you earn your right on the ground to intervene in a community that was at that point very much against having any Latino enter the community, and you were able to work there and kind of earn your license to operate there. So I think we got to look at technique, we got to look at who is intervening, and we got to look at metrics and who is doing the research, because that needs to evolve. So yes, there are specific metrics, but I also think we need to look at who is measuring, and is that research bias, and keep building it. So that's my take on that. I'm not a researcher, but I've learned from the experience in LA and in Central America and now in Oakland that CVI practitioners need to have more of a say on research designs, at least to be able to formulate what gets researched.
Thank you, Guillermo. I'll hand this one to Susan. I am a psych major student for Cal State University Long Beach and advocate for mental health. I would like the panel to discuss the importance and relation of CVI and mental health in the community. Susan, that's up your alley.
It is absolutely important. Any act of violence it definitely affects the person who has to suffer it, but there's also an effect, that happens to the perpetrator. And this is something that we tend to forget, or we tend, to gloss over. And I think we need to be able to push a little bit more about that. There is definitely a stigma already associated with committing a crime, with being violent, but yet at the same time, we glorify it. We perpetually engage in wars. We perpetually, look at movies and glorify things, that we think is. I actually know parents who feel more comfortable letting their children watch movies where there is violence than movies where there is any type of public display of affection or sex. And so what does that say to us, about our condition as human beings and our behaviors and what we find acceptable or not? And definitely, as I mentioned earlier, being able to talk to someone that can understand you on your level, because there's already an imbalance of power between a clinician and their patient or their client. Many of them come from privileged backgrounds. Many of them have never been shot at. Many of them have never, had the need, to hide in a porcelain bathtub during a shootout outside of their home. Many of them did not come from war. And so when someone goes and asks for help, that's a lot, to ask of a clinician who doesn't share those experiences. and you could read about them, and there's plenty of theories out there, to study, but it's not the same thing. So I'm a big proponent of helping, people who have lived experiences and want, to turn that for good. We have gang intervention workers that, as Melvin mentioned, many of them reach a point in their lives, whether it's through an epiphany or through a process of maturing, or something happens in their life where they want to give back, where they want to redeem themselves. And they make some of the best clinicians in the world. They make some of the best people to study this. They make some of the best people to research it and to say, this is what works and this does not work. So I think being able to encourage the folks in our communities, in our circles who have lived it on both ends of the spectrum, to encourage them, to give back that way if that's what they want to do and they're comfortable with it. And we should give them the support. When I remember a few years ago, I presented at a roundtable at the State Department on El Salvador. And I basically told them, what was my intervention program? Student loans. Because nobody cares about, me trying, to do something with my life. Because I was written off a long time ago, a refugee, a woman, an immigrant. I was written off by many ways. And so what did I have to do? I basically had to do with what I was able to find. And my intervention was school, was putting myself through school. And now, I have student loans, that paid for it. Well, that I'm paying for it. It shouldn't have to be that way. People should get the support that they need to be able to not only heal, but also to heal their families and their communities and the people that they've hurt.
Thank you, Susan. I have a question for Melvin, but Guillermo, do you have your hand up before I go to Melvin?
Yeah, I just wanted just to take a second to sort of just remind the questions that often come up about making the case for proving the effectiveness of this work. I think there's a certain bias within that question, because the largest investment in reducing violence has not been on community-based approaches. It's been in filling up our jail system. And that has not reduced the violence. So I think as practitioners of community violence intervention, we have this burden. It's almost like a double standard, that we have to prove through a randomized treatment and control experiment that what we do works, but yet the vast of the amount of investment is going into strategies that have a history of not working. So the disparity there, it's part of the problem, that we've been investing in something that doesn't work for so many years. And then these new practitioners that are risking their lives daily are being asked to prove beyond a reasonable doubt, beyond scientific measures, where the same standard isn't applied to other things. So I just wanted to just keep in mind that we have to be equitable in the way we look at this work and the expectations that we have of it and the demands that we place on having to prove scientifically something that we're getting there and we're doing, but keep in mind, most of the investment has been on things that don't work and continue to be on things that don't work.
Thank you, Guillermo. I'm glad you jumped in, and that was very well said. I could not have said it better myself. This one is for Melvin. How are CVI-focused organizations and gun violence prevention organizations working together with the common good of ending community violence? And so the way I'm reading it is like, for example, Giffords, Brady, Everytown, the GVP groups, how are they working with CVI orgs, or how should they be? I can answer that as well, but Melvin, what's your perspective on that?
I think, community-based organizations, have had challenges throughout the years effectively coordinating and collaborating on the ground. I think we're getting better. And I think that some of the work that Guillermo did as the director of GRID in making sure that we came to the table and we were intentionally meeting and strategizing and the creation of La Vida and the Metropolitan Peace Academy, where you got practitioners in a room together going through 14 weeks of training and building and talking and creating relationships with one another. Organically created a process where organizations start to work together. In Chicago, you know, it's been a challenge to bring those organizations together, but I'll say through the leadership of Jalen Arthur, folks at Metropolitan Peace Initiatives and Ready Chicago, we have been intentional about having regular meetings to, you know, assess what's happening in the communities that organizations are working with. We have quarterly get-togethers with outreach citywide. And I think we've come a long way, and I think that's happened in LA as well. But I do think we got a ways to go, because in order for us to be mission aligned, that means that we need to communicate even more. We need to be a little more transparent about what works at our organizations and what doesn't work. And I think also we got to be open enough to go to one another and say, look, you're doing this well. I want my team to sit down and get some training through your organization on how you're doing case management work or life coaching, or your strategies on the street where you're intervening in conflict and creating non-aggression agreements and peace agreements. And so I think incrementally we have made changes, but I think we still have a long way to go, because the only way we're going to reduce violence in the community is two ways. One is impacting the highest risk individuals who are engaged in the violence. There's no way we can come into a community and say we're going to reduce violence and we're working with at-risk individuals. We're saying we're working with the acutely at risk individuals who are at highest risk of shooting and or killing somebody. And so I think we've gotten better, but we do have a ways to go. But coordination, effective communication, real honesty, and us aligning ourselves in our mission. And the result will come when people start speaking the same language and they start coming together and supporting one another's events, one another's work in the community, and people are operating together. And so we've made strides, but I think we still have a ways to go.
There's a lot of great questions here. Some of them, I don't want to say easy, but can be answered pretty quickly. There's one, someone asked, how do we feel about the word gang? For me personally, I feel like oftentimes like terms like gang in particular is really more about semantics than anything else. Although I'll say that in my work, I've seen, we created a middle school intervention program, and we had to stop calling it a gang intervention program or a gang awareness program, because it can be seen as a rite of passage for kids that are wanting to be validated as gang members. So in that sense, that the term can be counterproductive. And also in a hospital setting, I spent a lot of years working in hospitals, and gang is not a word you want to use in hospitals. It just freaks people out. Administrators, nurses, although a bunch of gang members could be laying in their hospital beds. So sometimes gang can be a problem. It's a heavy word, but I don't think we can get away from using the word gang, to be honest, because as long as the communities are using it, it's all over social media, it's all in the music. So I mean, it's kind of like a word that is out there. But another thing is, I wanted to give Soledad an opportunity, and I know she's gonna end the webinar later on, but for her to chime in regards to her work and N3's work as it relates to research, I think it'd be a perfect time for her to jump in really quick.
Thank you, Paul. Yes, I was chomping at the bit when you were all talking about the research, and especially when we're talking about what does success mean in this space, and Guillermo's point about who is determining the questions, who is determining what we measure, and all I have to say is yes, yes, and yes. So at Northwestern's, at N3, we, as I mentioned earlier, take this engaged research approach. And what that means for us is with our research partners at Chicago Cred, at Communities Partnering for Peace, and other outreach organizations, at the very beginning, we sit down with them and say, what do you want to know? What is it important for us to look at? And we also take not just a quantitative approach, but a qualitative approach, which is critical because we want to hear the stories. We want to hear the stories of the staff who is doing this work. We want to hear the stories of the staff, of the individuals who are participating in these programs, and the families, because it's not just the impact to the individual, but as you've heard repeatedly, it's the impact to the families and communities beyond that one person. And so I just wanted to flag that that is critical. And for us, what that has meant is that we, yes, we are looking at, arrests and victimizations, and we are looking at, of course, the numbers of fatals and non-fatal shootings, but we are also looking at whether participants are getting their GED. How are they measuring their health? For some, it's the first time that they were ever asked the question, how are you feeling? And what we get from those kinds of interactions and those conversations is truly priceless. The other thing I think that is really important to highlight is that this kind of information, these narratives, these stories, helps all of us shape a broader narrative around what we mean with about this work and what we mean when we talk about success. And I always want to highlight the expanded work that is often not talked about, that outreach organizations and other community practitioners did during the pandemic in particular. So yes, they were doing the work to stop gun violence, but they were also stepping up and serving as de facto public health workers when other institutions were forced to step back. And that's, they were going in and providing food and diapers and other kinds of basic services for their communities. And that's critical. Those are critical stories and services that are often left out when we talk about the impact of these organizations and the community violence practitioners, but also when we talk about what a success looks like. And I will put in the chat my contact information in case anybody has specific questions about our research, but it's really important to us. So I just wanted to flag it and thank you for raising that.
Great. I think Susan wants to jump in on the word gang, and then I think we have maybe one more question for the panelists. Go ahead, Susan.
One of the interesting things that I found when I moved to the East Coast after living and working in LA for so many years was how regionally the word gang is used. I worked in Baltimore at the University of Maryland for a long time, and I couldn't find anyone, who could say that there were gangs in Baltimore. And it's interesting because when you look at the law enforcement definition of gangs, there were plenty of gangs in Baltimore and in surrounding areas. And then when I started working in DC, I noticed the same thing. In Baltimore, it was explained to me that when you have a population, Charm City is over 75% African American. And the explanation that was given to me was, why would we criminalize our own kids by putting that label on them? And it made so much sense. And in DC, it's a similar thing, although they do use the term crews when it comes to African American youth, but they use the word gangs when it comes to Latino youth. And again, I found that very interesting because it suits a purpose. In El Salvador, where I'm from, gang members by law are called terrorists. And unfortunately, what it does, when you label a group to such an unbelievable and unredeemable, category, is that you close all doors for them. And I have explained this as a way, when you understand, the power and control dynamic of domestic violence and how someone wants to maintain someone feeling like they're isolated and subdued, this is what these terms do to people. And, the policymakers and law enforcement and other institutions, that use these terms to describe a group of people, which is very specific. They're usually Black or brown or poor. And, it's very specific who they use. You will never see kids from the west side of LA being called gang members if they're white and middle class. Never. Okay. And so you have to question what that does and what its purpose is. And really what it does, it makes people feel isolated. It makes people feel like they have nowhere to go. And it actually reinforces the fact that the only ones that are going to be for them, that are going to be there for them, is the gang itself. And that's a problem, that is never talked about. So people will say, well, what's in a name? There's a lot in a name. And I think, what I learned in Baltimore, told me that we who come from communities that are generally labeled as gang members or terrorists, we have to speak out on that. Because if they're not going to give us any solutions, if they're not going to give us any resources, but in fact, they're going to be using, these labels, to just keep us in a world of hopelessness, and that's a problem.
Thank you, Susan. I do want to briefly, I have a question for Guillermo on in regards to identifying and screening folks to figure out if they're at high risk or not. But I just want to read a comment by looks like Freddie Pablo, who was talking about there's a lot of great information, experience being shared, but I want to highlight the idea underlining systemic factors that affect violence in the community. Absolutely, 100%. We talk about that a lot at Giffords. Is a lot of what we do is everything that we do is important and is needed, but at some point, right, if we're not getting to systemic change, then we're all just kind of going around in circles, right, for the remainder of our careers. Because every day there's another group of kids that's ready to pick up a gun and use it for various issues, including systemic issues. So I want to highlight that really quick. Now, Guillermo, obviously when you were at the grid office, you developed the Y set and the set. And so, before I left, I kind of copied you to some extent. Before I left Crossroads, we developed a tool called the chat for hospital interventions with USC, Dr. Huey, to interview patients, victims of violent crime, to gauge their level of risk for re-injury. And then we also created a tool for middle and high school students and their level of safety and risky behavior, et cetera. But can you talk about tools? You and I talk a lot about that, and I think agree in a lot of ways, how valuable tools can be in really helping to provide like a clear picture, as close as we can get to whether or not they're high risk or not.
Mm-hmm. Well, the most unreliable testimony in court is eyewitness testimony. So I think we do need, as practitioners, we need to keep evolving and having tools to complement what we see. We do have intuition and ability to assess. So to me, a tool is just an added tool. I do think it's necessary because this idea of high risk or people at risk or people at the highest level of risk can get a little bit confusing if we use exclusively a law enforcement criteria. So just one quick anecdote, in Honduras, we went in and did risk assessments on every individual in the youth facilities, the prison system for youth in Honduras, and found that many of them were not really at the highest level of risk. They were in terms of their action, but psychosocially they were not. So I think that's also evolving, and I'm glad that there are other people kind of coming up with risk assessment tools, and not that they're going to be 100% accurate, but nothing is. We just need multiple ways of checking that this particular individual will not get the wrong type of medicine. This is not just for diagnosis reason. If you have a pimple and you get chemotherapy, you're going to get worse. So the same thing is with the interventions that are being used, that we can, in fact, make kids worse by how we approach them. Let me close with a personal anecdote. My dad never wanted me to be a musician because musicians are up all night, they travel a lot, they party a lot. I thought that was the greatest reasons to be a musician. So sometimes we approach a youth looking to prevent him or her from becoming a gang member. And the way we approach that youth actually encourages that. So that's why I think tools are important. We got to keep developing them, making them more accurate. And that is evolving too. This whole field is evolving. This is a really exciting time that you'll see practitioners and researchers and policymakers working together like never before. So I'm very hopeful about where we're going.
Thank you. I have a quick question for Melvin, and then I'll ask each panelist to give us like a closing remark. Melvin, you described the CRED partnership with Soledad and N3 using the dashboard data to support CVI collaboration in Chicago, North Lawndale. Is the approach being used elsewhere in Chicago?
Not yet. It takes some time to develop the infrastructure internally for organizations to be prepared to operate at that level. We're just kicking off this project in North Lawndale. And so the goal is to extend it if it works. So we'll be challenged to serve 700 individuals and all of the minutia that comes with working together, serving high risk individuals. There's a lot of work that we have to do and a lot of assessing that has to happen. And so our goal is to expand it. And hopefully we do, but it doesn't make sense to expand this if we're not successful. Paul, there was a question in there that I'd like to answer. They asked about if these kind of strategies could work in institutions. And I wanted to answer it because you and I both worked in Supermax facilities. And myself and a team of other intervention workers for about 5 years worked in LA County Supermax facility. And for 5 years, we taught life skills, but we taught the life skills through the AmeriCAN program. Hall of Fame football player Jim Brown created the curriculum. And we went in to initially teach life skills, but we added a twist to intervening in there. And so the deputies gave us our own dorm, 64 inmates, highest risk individuals in the facility. They were in our unit for 3 weeks at a time, and we were there 5 days a week for 5 hours, teaching life skills and intervening in conflict. What the sheriff's department found out is for 2 years straight, violence was reduced in their facility because we had served thousands of inmates that were in there facing murder charges, a lot of time, and they were the highest risk individuals. And what ultimately happened is those inmates became ambassadors for the work, and they had really internalized the change that they incorporated by going through that curriculum and graduating and receiving certificates. And so for 2 straight years, there was a reduction in racial violence, which is huge. And for those that know the LA County system, you know that the most of the violence is based on racial issues. And so the LA County extended our contract because they thought, number one, it would just incorporate an opportunity for inmates to learn life skills. But as they saw deeper, the reduction in violence was so impressive that they extended our work several years. And so there is an opportunity and a strategy to do that. I think the folks in those institutions have to be open-minded. They have to be progressive thinking and open and willing to take risk. And if you're open and willing to take those kind of risks, you could definitely see the rapid decline in issues in those facilities. Paul, I know you did some of the same work as well.
Yeah, absolutely. And we're short on time, but what I will add is that, it was the same case, is that when administrations changed, when the sheriff changed, we were pushed out, and then we're back to 2 or 3 years of trying to get back in again, right? So law enforcement obviously often really holds the keys in terms of letting us get in there and work with folks. And that's true reentry, is when you can start off while they're incarcerated, and then work with them as they transition out to the community. So we're pretty much at time, and I'm going to hand it over to Soledad in a second, but I just want to kind of bring us back to where we originally started, is talking about what CVI is and what it's not. And so Brittany's going to post in the chat a link to our report on the front lines that we did last year in support of street outreach workers. And we offer a basic definition of community violence intervention, which is what I referred to earlier, right? The criteria that we chose in interviewing workers for this report was, number one, that they work with the highest risk individuals, meaning those at risk of being shot and or doing the shooting. Number two is that they spent at least 50% of their time out in the community. Some people, and I'm not saying they don't, but some people say they work with highest risk and it's very dangerous work, but they never leave their office. And you all know that some of the most violent individuals that need services will never show up to your office. So that was the second criteria. And then the third was that they offered an intervention, which could be mentoring, case management, life coaching, job development, tattoo removal, et cetera, et cetera. So those were the kind of three criteria as far as the workers and as it relates to CVI. So the last question for panelists, I'll give you all an opportunity to just offer your opinion or maybe some inspiration for all of us. And where do you see the field of CVI going in the next 5 to 10 years, in your opinion? And we'll start off with Melvin.
Great question. I'll be brief. I know we're limited with time. I see that this work will continue to get innovative nationwide. I think strategies of assessing our work, documenting work, and bringing in new strategies to help reduce violence will happen. I'll say the thing in closing that's going to be important for any city is having public-private partnership and having private unrestricted dollars incorporated in the strategy, because it goes a long way when you have those resources connected. And give community violence intervention a shot. It works. I wouldn't have been in this work as long as I have been if it didn't.
Thank you. Guillermo.
I'm very excited about where the field is going. I think a must is that as people take positions of leadership, then the true systemic change, structural change can take place. So I'm a big proponent for bringing those credible messengers, people with license to operate, whatever term you want to use, to become part of city government, because I think city government needs to shift the way we address marginalized communities. And the people most able to do that are those from those communities. So we need to keep building the power base of local government, if you will, and even national government, with credible messengers, people with license to operate, people that, like the people on this panel. So as long as the leadership keeps growing, the profession will continue to move forward. So that's very exciting to me to see that happening. So thank you for putting this together, Paul.
Thank you, Guillermo. Susan.
I've often have answered the question about how do you measure something works or how do you do something. And I have always said, that it's the relationship that's the real intervention. And so how do you measure a relationship? I think the pandemic has definitely shown us, the importance of, being present. This current crime wave, that the media is talking about has a lot to do with how, we have neglected or, beyond the circumstances in our control, our relationships have suffered. Our relationships with our families, with our co-workers, with our community, with everyone. And we're seeing the symptoms of that. So I think as we learn, from the pandemic and how it isolated so many of us and continues, to isolate so many of us, that we focus on the relationships, that we foster and that we grow and that we maintain. We cannot expect, to be able, to intervene in anyone's life if we don't have a relationship with them, a good relationship at that. So thank you for inviting me. It's really good to see everyone.
Great, thank you. I'm going to hand it to Soledad, but before I do, I just want to apologize to those whose questions were not answered. But I will say, to be honest, you really let us know that we're on the right track with this 4-part series, because your questions are very much in line with the next 3 installments of this web series. So I promise you, if you're willing to, jump in on the next 3, which will be a month apart, you won't be disappointed, and we'll have more time to interact. And so I just want to thank all the panelists. I want to thank N3. I want to thank my team, the Giffords CVI team, Mike, Brittany, Juan, and Jordan. And I'll hand it over to you, Soledad.
Thank you, Paul, and to all our panelists for a truly engaging conversation. And thank you to all of you for your thoughtful questions. As Paul said, we hope you will join us for the next session in the series on Thursday, May 19th at 10 a.m. Pacific, where we will center the work and life experiences of street outreach workers and staff and share what we are learning about this critical workforce, including demographics, work supervision, exposure to violence, coping with work stress and trauma, and economic and social well-being, as well as attitudes on policing and the law. And we will discuss the policies and supports needed to ensure we're developing the infrastructure necessary to sustain and support the profession. So more details will be sent following the webinar. But for now, again, thank you for joining us, and we'll see you next time.
There's a link in the chat to register for the next event. Pat Adams posted it. Thank you very much.
Thank you.
Have a great day.